Africa is a vast continent, and so we have disparities. North Africa and South Africa have fairly better health facilities. But when I am talking about Africa, I'm talking mainly of what we call sub-Saharan Africa. That's essentially West Africa, Central Africa, East Africa. It's not as if South Africa doesn't have their disparities or North Africa, but they have a slightly more developed health system. Now, going to the subject of prostate cancer. Prostate cancer is the leading cause of cancer in men over 40 years in Africa, and also the leading cause of cancer-related deaths in Africa, in men. And now there are increase in the number of cases of prostate cancer that we see in Africa. It's rising. Now the rise may be due to two factors. One factor is the fact that we are having better diagnostic capabilities. And so we're detecting more cases of cancer. And then secondly, also is the actual rise in incidence due to genetic factors, environmental factors, and also we are tending towards living the traditional African type of diet and lifestyle. And there is a tendency, especially for the athlete, towards Western diet and lifestyle. Also, so those are the contributing factors. Then also Africa, just like the Black African Americans, they are relatively at higher risk of developing prostate cancer. Not only developing prostate cancer, developing also relatively more aggressive variants, and also at a relatively younger age. And so that gives us the picture of prostate cancer in Africa. Besides that, despite this high volume of disease or high burden or large burden of disease, we have poorly developed health infrastructure. We have most of the places practicing out-of-pocket payments. So the insurance policies are not so well available. And then, so the infrastructure is limited. Then also the awareness of prostate cancer is not so fantastic. The awareness for the risk factors, the symptoms, the possible outcomes of treatment are limited. And so because of all these things, they give the confounding factors. So if we want to, haven't seen this large burden of disease, rising cases, poor infrastructure, and then because of the limited knowledge, lack of awareness, most of our patients present at later stages of the diseases. And because of the presentation at late stages of the diseases, and also relative socio-economic factors, so the outcome of treatments are also negatively impacted. So having had this picture of prostate cancer in Africa, for us to modify the diagnostic pathway, we need to adopt strategies that will improve the rate at which we make accurate diagnosis, and will also improve the interval before diagnosis and treatment. So the aim will be, first of all, it will be a multifactorial approach involving the communities, the individuals, the healthcare systems. All this, there needs to be modification in all these areas for us to have improvement in the outcome. So going specifically for the modifications, so our aim therefore will be, first of all, to decrease the diagnostic interval. By that I mean the time a patient presents, sees a doctor, is evaluated, and then referred for appropriate treatment. So we have to shorten that time. Then we also need to practice this shared decision-making with the patients and the physicians, telling them about the risks and the benefits of early detection. And then we have to go to the real diagnostic pathways of taking a good history, physical examination, and doing some laboratory tests, and then confirming the diagnosis. And then if the diagnosis of prostate cancer is confirmed, then we also need to stage the disease. So modifications in all this area is, in this context, what we're talking about.